Good morning. My name is Mr Aslam. I'm a consultant orthopaedic surgeon who specialises in robotic surgery. We're going to talk about what to do with patients who have severe arthritis. So the joint is worn, which has led to narrowing of the joint space, perhaps some deformity and difficulty in the quality of their life. The options will depend on how much damage there is and whether the knee deformity can be corrected and whether the other structures in the knee are maintained. So let's take the example of a patient who's worn on the inside of the knee, but they've got normal anatomy on the outside of the knee. So these patients will ideally correct the deformity, so it's flexible. They'll have a straight knee and they'll be able to bend fully. In those patients, we know from our historical studies that removing the whole joint, in my opinion, is a drastic option. And a better option is to replace just the part which is worn. This is known as a unicompartmental or partial knee replacement. And it has, in my view, advantages in that you preserve bone, you just replace the inside of the knee, and the patient still have most of their normal knee, which will give you less pain, quicker recovery, and the knee will feel more stable.